Hey guys, welcome back to another episode of Nursing Uncharted. This is the second part with Miss Sarah Boes. We did talk about some pretty heavy things in the first episode, so if you didn't listen to that, please go back and listen to part one before we dive into this one, because it's going to make a little bit more sense if you listen to the first part. If you're not, just briefly tell me a little bit about yourself, Sarah, again, and we'll kind of get into where this episode's going to lead to showing what it's like to be on the other side of the bedside as a nurse.
Yeah, in the first episode, I kind of introduced myself as a nursepreneur. So I am a nurse practitioner, but also an entrepreneur who started my own business during COVID, teaching other nurse practitioners how to pass their board exams. And it was a really beautiful, fun business because it was all centered around mental health and really dampening down your anxiety, building up your confidence, and being in a really good spot to take the exam, but not just the exam, also entering the practice too. And we didn't talk about this in the last episode. I went on to sell that business into a bigger test prep company just 3.5 short weeks before I found out that my daughter was going to have a set of 4 different heart defects. So my journey kind of pivoted very quickly in all the ways.
And we talked about this briefly in part one of these 2 episodes, that you had the underlying anxiety diagnosis, but your OCD aspect of that came after the birth of your daughter. Mm-hmm. So let's talk about your daughter a little bit. Tell me about her. Tell me her name. Let's kind of let's start from the basics and get to what that was like being on the other side of things.
My daughter, her name is Meadow. And today I love to tell people, I like to start here because we're always like, how is she? Is she okay? So a few weeks ago, they're like, I don't know how to ask, but did she pass? And I was like, no, she's here. She's here.
Oh, gosh.
So that being said, I have a very beautiful, joyous, curious, playful 2.5-year-old now that I love having a part of my life, and I love being a mom. And unfortunately for her and our family, I found out at 36 weeks pregnant that she was going to have a set of 4 different heart defects that are known together as tetralogy of Fallot. And what tetralogy of Fallot is some holes in her heart, some pieces that are missing. For her specifically, she has one of the most severe subtypes of tetralogy of Fallot. And so she was born without her pulmonary valve, and that adds a lot of complexity to her case, and that adds a lot of complexity to her care. And so she had her first heart surgery at just 6 days old. She was a little tiny baby. And that went way better than we anticipated, and we were all so excited. And then she was able to come home for a little bit and have something called interstage time. And so interstage time is where you're basically operating a hospital, but in your living room. So you get the fun parts of being home and the flexibility and just the comfort of being home. But she was hooked up to oxygen monitors all the time. We had an app where we submitted her weight every day. If she did not gain her 30 grams, we had to bring her in to the doctor. So everything was super regimented and super watched, because that first surgery was basically just a patch for her to grow bigger and stronger for that second surgery, which is what they call her full repair. Full repair is a little bit deceiving, though, because this is ultimately palliative care, and there is no cure for congenital heart disease. And her lingering piece today is her heart valve is fake. And since she has this artificial heart valve, every time she grows exponentially, she quite literally outgrows the valve. Right. And we're living kind of on the cusp of medicine right now, because if these clinical trials pan out, there is a world where she might have her future valve replacements via catheter. So literally do a heart cath same day in and out procedure. I know. It brings you so much joy.
Yeah.
But if medicine does not catch up in time, we're looking at 4 more open heart surgeries in her life. And that's a lot to sit with. And that's really big for us as a family, because her second surgery went poorly. Is not the right word, but she had a lot of complications that no one anticipated. And We thought that we were going to have a week and a half hospital stay, maybe, and we were in the ICU for 2 months.
Oh,
So
wow.
our lives were very much consumed in Meadow and her heart defect for the first 6 months of her life.
Yeah, and I know when we talked initially, was your OCD diagnosis, was that after the second surgery, or was it after the that time where she came home in between?
It was after the second surgery.
Yeah.
I felt like everything from the moment Meadow was born until we brought her home from that second surgery was pure survival mode at all moments. And like, I
Mhm.
just really had no space or capacity to think about myself and my brain and what was going on. I'm just like, here is my baby. I am her nurse. I'm going to take these measurements. I'm going to do this thing. I'm going to submit this data. But it was only a week after we came home from the hospital that I had my OCD diagnosis. And just for perspective, how bad it was, the OCD scale is called the WABOC. It goes up to 40, 40 being like extreme of extreme OCD. And on the day I took that assessment, I scored a 37. So I
Wow.
definitely had OCD, and it was definitely impacting my life, and it was very loud.
Wow. And I just, you know, I'm a NICU nurse. So, I do, gosh, I do. So people always ask me, are you going to have children of your own? And sometimes it really makes me anxious because I can't imagine having to do everything I do at work and to
At
come
home.
home and have to do it,
Ooh.
and just it never having a break. So you talking about bringing her home as a nurse, you're a nurse, as a NICU nurse, that's terrifying even for me to think about having parents do that. And, this happens to families that don't even have a medical background, and they're now all of a sudden a nurse taking care of a critically ill cardiac baby. Like that's, it's kind of incredible to think about that we're able to do that, or even families are willing to do that. But I think families that don't have the medical background probably don't understand to the extent of what you did, having, Meadow home with you during that time between the surgeries.
Yeah, what I tell people so they can wrap their heads around it, this patch was the size of a diamond stud earring. And so if that patch clotted off, she no longer had blood flow to her
Yeah.
lungs. And when she emergently ended up having to have her second surgery, it had narrowed to half the size of a diamond stud earring. I
Oh,
like breaks my brain to think about like that was all that was like giving her blood flow.
yeah. Yeah. It is. I mean, I will be completely honest. Cardiac babies they scare me. Like that was
They scare me a little too.
yeah, when I entered into the NICU world, I was a transport nurse, and I would have to go. We didn't do major cardiac surgeries at the NICU that I worked at, but we would go get them because we were a large hospital in a very rural area that
Mm,
surrounded like 3 hours. So,
wow.
and those facilities had no ability to care for these cardiac babies, like didn't even have PGEs on hand, you know? So
Different life.
I, yeah. So I would have to like go and get these cardiac kids. And I remember having this conversation with one of the neonatologists, and I'm terrified. And he said, read, learn about them. Like that's gonna help you. And now I'm like obsessed with them. I'm terrified, but I'm obsessed.
Knowledge is
You
power,
know,
though. I tell
yes.
other heart parents that all the time because like you get this
Yeah.
diagnosis and it's abstract and it's scary and you don't know what's happening, but you are going to be your child's best advocate and you're going to be the expert to your child and their nuance and their personality. So you also have to be an expert in their heart, medical background or no medical background. Because my husband, for example, before I started my business, he worked with me a little bit in my business, but he was a truck driver. He
Yeah.
has zero medical background, but he can tell you all about Meadow's heart.
Yeah.
So if I'm not there, he can advocate in the same way that I can too.
It is amazing to see, even, from my experience, NICU parents understand what's going on. It's almost like you get some fulfillment out of that. You even educated the parents to the fact that they now can reiterate these medical terms to you in the correct
Yeah,
way. And
it's
and it's
huge.
true. Yeah, and just like any family member being in the hospital, you have to advocate for
Hmm.
your loved ones, and the more you educate yourself, and even a nurse, like you didn't do NICU, so you had to learn about this, and that's that's a lot. It's a huge responsibility. And, a big thing that I wanted to highlight in this episode was being on the other side of the bedside as a healthcare professional. That's hard. you
It's
know?
like it's so hard, but so incredible at the same time because there will be times, I can't think of anything specific, but my husband would be like, "Why in the world would they do it in this order? Or why would they come in at 5 a.m.?" And I'm like, "Oh, no, babe, we're on hospital time." Okay. Like, hospital time and our time are very different,
Different.
and this makes a lot of sense if you're on the external view of this. Like,
Yeah.
her getting weighed at 5 a.m. before the cardiac surgeon rolls in at 6 a.m. and we're making decisions at 7, like, all of that comes together. So even just having, like, hospital time understanding was really
Yeah.
nice for me and him to not be frustrated.
I never
Um,
thought of that, though.
yeah, but he would be like, "And why are they doing that now?" And I'm like, "Oh, babe, hospital time, hospital."
So I guess it did help a little bit, but I just can't. I mean, even when I go visit a friend or a loved one in the hospital or even myself, I've landed myself in the ER twice in the past like
Ugh.
2 months. And it's like, okay, my like pulse ox keeps beeping. So I'll just like take it off and I'll be like, just silence it. And then I'm like, oh, I probably shouldn't do
Wait, I
that.
shouldn't do that. Yeah. I was really, really, really bad for that. I was really
Yeah.
bad.
So just to kind of talk about like the OC, like I know we talked about this in the previous episode, but
Mm.
with the OCD and that diagnosis, did did the tools in the diagnosis then help you with the care and managing having Meadow at home with you? Did it did it alleviate some of the stress, or was it still pretty heightened because of just everything going on?
I think, you know, Meadow got out of the hospital at almost 6 months old. I got my diagnosis with OCD and I started like wrapping my head around what that meant and what that even looked like for me because my baseline understanding of OCD just like didn't really match the symptoms I was having. And so I think to understand just even my headspace and what I needed to work on, number one, I thought that there was something in my pregnancy that I did that caused her defect. And
Yeah.
I would play on endless loop. Was it my deodorant? Was it my shampoo? Was it the shrimp ceviche? I ate that one time by accident and I didn't know it was ceviche. And like I still remember like all these specific things because I played them on loop so many
Yeah.
times. And I also, maybe it was gut, maybe it was anxiety. There's no way to know. But I had anxiety my entire pregnancy that something was wrong with Meadow. And nobody listened to me. They're like, oh, like you're just anxious. You're just anxious. And so then to feel like my OCD got it right when we got her diagnosis was really hard because now in my brain, I'm like, oh, my OCD is something I need to be listening to. And the other layers that I was kind of going through too was there was a lot of compulsive checking. And so we brought Meadow home from the hospital and she's supposed to supposedly be healthy now. And we're supposed to be able to sleep without monitors. But I would fall asleep for just a little bit and I would wake up and I'd be like, is she actually breathing? And I
Yeah.
know there are a lot of parents that do this behavior, but I would get up and I would feel her breathing and be like, oh, okay, she's good. I'm good. I would lay back down and fall asleep for a little bit longer. I'd wake back up. I have to redo the process. But the thing about OCD is it becomes like these insatiable compulsions. And so maybe the first time I felt her breathe 2 times and that was good enough. And then the next time I wanted to feel her breathe 5 times. And then by the 10th time I've done that, maybe I need to feel her breathe 95 times to be able
Right.
to settle back down and sleep. And so you end up in this compulsive
Yeah.
cycle trying to alleviate anxiety, but the anxiety just grows bigger because what you're searching for is certainty. Like I want to be
Right.
certain she's going to be okay. But unfortunately, there is no certainty that she's going to be okay. There's no way I can know if her heart is doing what it's supposed to be doing in there. Like there are signs to point to, like she's a normal, healthy 2.5-year-old, but we just
Yes.
don't know for sure, right? And the whole like goal of treatment is just being able to like sit in that space and be like, maybe she's okay, maybe she's not. But like I can trust myself to know that like if things start to pivot or change, like I would take her to the ER. I would do the things that I need
Right.
to do.
But
But
that's
when you
hard.
it's
That's hard.
really
Like you
hard.
said, that's hard as just a parent, let alone having with or without an OCD diagnosis.
Mm.
It's I I see it all the time. Like I have to turn the monitor away from parents because the monitor will go off, and I'll be like, "Is your baby breathing?" You know, because
Yes,
they're
look at the
usually skin
baby.
to
I
skin.
told my husband that all the time. I'm like, look at Meadow. Look at Meadow.
Yes. Yeah, and it's hard, and, I'm glad that that experience brought you your diagnosis to know how to help you, live your life without these constant anxious feelings, but it almost can be a triggering to someone that maybe didn't even have any OCD symptoms prior.
Well, there's definitely a lot of like trauma overlay with OCD and all the
Right.
things we've been through. But now that I have an awareness of what OCD actually is, I'm like, oh, I've lived my whole life with this. Like,
Yeah.
I had no idea at the
Yeah.
time that this is what it was. But I definitely, like, me and OCD have been buddies, whether I liked it or not.
Oh gosh. Oh gosh. Was there anything that happened specifically during her stay that triggered that? Or do you think it was just the overall, not trigger's the wrong word because this was always present, but is there anything that really brought that to light during like the stay?
So the day that she had her full repair, she's supposed to be in the OR, I don't know, like 10 hours. She was in there way longer than that because she was already having complications then. And then when they brought her back to her hospital room, they were like, kind of like a puff and fluff. They're like, oh, we're going to get her situated and we'll bring you back in a half hour.
Yeah.
And then hours went by and we weren't brought back. And I was like, this is going really, really bad back there. I was like, I don't know what's happening. And that's the other thing too. Like, we had no idea what was going on behind the curtain. And that was equally as scary because then you like start
Yeah.
creating all these things, right? And so
Well,
by
and
the
as a
time
nurse, that time is not normal.
yes,
So that
yes,
brings
it's
it
not
back
normal.
to, yeah,
Well, I'm like, well, they told us a half hour and now it's been 2. Like,
yeah,
so all that being said, by the time that it was like 9 p.m. and we're making it back there, I was just like so overstimulated and so overwhelmed. I hadn't slept the night before, like all these different pieces. And so I told my husband, I was like, I know in my medical brain that there will be decisions to be made tomorrow. I am not going to be able to make those decisions if I sit in this room tonight with these fluorescent lights and these 2 nurses and the because they had 2 nurses in her room and an attending at the time. I was like, so Meadow has the care that she needs. I need to get at least 4 hours of sleep to be able to like be a functioning human and figure out what the game plan is for tomorrow and participate and be an advocate and all the things. Because we had such a crazy day when I left to go to a hotel that was literally 4 minutes down the street. I didn't bring a phone charger. And so my phone had like 20%. And I was like, I'll put it on airplane mode. If you call me through Wi-Fi and it will ring through anyways. And my phone ended up dying. And so Meadow took a turn for the worse in the middle of the night. And my husband's calling and like he doesn't have the medical background. He needs me there. He wants me there. And essentially what happened was they had to leave her on blood thinners until her surgery, even though that was not the plan and nobody wanted to do that because her shunt had narrowed so much. So when you weigh like the risk versus benefits, they're like, we can always give her more blood. But if that shunt were to completely clot off, like that's like, that would be beyond emergent, obviously.
Right.
And so in the middle of that first night, she ended up developing a cardiac tamponade because there was so much blood in her chest and so much going on that her heart wasn't able to beat. And how you fix that is they literally at the bedside, they made her room an OR. She wasn't even stable enough to be moved. And they reopened her chest and they left it open for a week to just give like space and time and flexibility, all the things. But in my OCD brain, I was like, this happened because I wasn't there and this is my fault. And now from here on out, I cannot leave this baby. I cannot leave my husband. Like I have to be hyper vigilant in every way that I can. And then the one singular other time that I left the hospital, she literally pooped so much blood. She had a GI bleed. She pooped so much blood. It went all over the floor. Like the attending was like, I've never seen anything like this in my entire career. And she's like, I've been doing this for like 3 decades. So then that just reinforced my OCD that it is not safe for me to leave. And there's something about me being, because the magical thinking, right? There's something about me being here that keeps her safe. And living through that experience just took my OCD to, like, it was already
Yeah.
there. It was already
But it
going
just,
wild, but it was next
yeah.
level. It was next level.
Gosh.
I couldn't do it by myself.
I'm just so grateful knowing that she is a happy, playful two
Yes,
and
I
a
was like,
half.
I
You
gotta
said
start there.
2.5-year-old?
Yes, 2.5.
Yes. Yes. Because hearing that it's terrifying. And, it's, oh gosh, yeah. And again, being a healthcare professional and knowing all of that stuff, it changes. I mean, I'm speaking from very minimal experience with being a loved one of someone in the hospital, but being a mom to a congenital heart defect
Teeny
baby.
tiny baby. She
Yeah.
was 4
I
months
mean,
old. She was so tiny.
yeah. I mean, and as a cardiac babies, they're tiny. Like you said,
Mhm.
if she didn't gain her 30 grams a day,
She's gotta go.
you know, yeah, she got to go back because
Yeah.
they got to be, they got to be healthy and big and ready for surgery. So,
Yeah, best
you know,
outcomes.
yeah. Did you, from your experience being on the other side, did you learn anything as a nurse? Did you learn anything from that experience that you could take away from that?
For me personally, so I got stuck in this thought loop that if we could just make it through Meadow's heart stuff, she would be normal. Normal is very subjective, but like
Right.
she would have true quality of life. Like she could be a fun running around 2.5-year-old one day. But during all of her complications that she had, and because, when you do open heart surgery, you have to literally like stop the heart and put them on a lung heart bypass, all the things. She ended up having a stroke.
Oh,
And when she was like in the worst of the worst, with her chest just like open to the world, like you could literally like stand above her and watch her heart beat, was when we found out that she had also had this brain bleed. But because she was so heavily sedated and they kept her so cold, which is,
yeah.
um, there was really just no way to know what that brain bleed was going to look like until she grew. And we just saw
Right.
how that shook out. And the people that had that conversation with me and my husband did everything together. Like everybody on that floor knew that like we were a unit and we were a team and we made decisions together and all the things. And he had stepped out to take a shower for a little bit, and they came to give me that news when I was completely by myself. And I was pumping at the time, and there were just like a lot of layers. I'm like trying to
Yeah.
unhook my breast pump and do all the things, and I'm by myself. And then like for me, I hear some of like the worst news I could possibly hear, because it was like the last little bit of hope I had was
Right.
gone in that moment. And for me, it was just like a really good lesson actually, because I had been an oncology nurse and I had helped deliver bad news, but I had just never gotten news in that way before. Because like when we got
Yeah.
Meadow's heart defect diagnosed, that was bad news. That was not news that I wanted.
Right.
Um, but there was immediately like resources and an action plan and all of these things. So to get bad news that really had no plan and completely by myself, and I'm depleted from weeks long hospital stay, it totally like gave me new perspective for the future of how I would talk to patients, or even just people in general that I'm giving bad news to make sure like if you're going to give something that heavy, making sure there's resources all around it,
Right.
and making sure also that the person is, no one's going to be ready to hear bad news, but in the best spot possible.
Yeah.
And when you're pumping and alone is probably not the best.
It's not the best.
Oh,
I
no,
mean, when
it's life, but
pumping is emotional. I mean, there are times I'll
it's a
go in.
very intimate thing.
Yeah.
Like,
And I mean, I'm used to it because again, NICU, everyone's pumping at the bedside.
yes.
So I'll go in and have these like conversations like, oh, hey, like what'd you do last night? And they're just like
Hmm.
pumping away. But it triggers them. I've noticed that it triggers a lot of emotion. So, I
So
think
many emotions.
I think that's a really good point for, people listening to take away from that as a nurse. Like, know your surroundings and
Yes.
know the situation and be aware of, okay, wait, like her husband just stepped out to get a shower. Maybe we wait like the 5 minutes, 10 minutes for him to come back. Let her finish up pumping. Let's
Yeah.
sit down and have this be,
Regroup.
as, yeah, yeah. And I think that that's a really good point to make. And, from your experience, I think that that will bring some insight into people being maybe more aware of how you're delivering any information. And as nurses, we're not the first ones to deliver that information, but we can advocate. with the physician, because surgeons come in and out and they don't care, but we can kind of step in and be like, hey, hold on. Her husband just stepped out.
Yeah,
Please
yeah.
give her like 5 minutes, or let me try to call and see if I can get him in here.
Yeah,
We
because if
need
they had
to.
told me they were coming to give me news, I would have been like, you need to get out of the shower at this point.
Right.
You can
No,
shower later,
exactly.
okay?
Yeah. You could, yeah, just come right now. Yeah. So I think that's a really good piece of advice, to take away from this. But are you still at the bedside, or no, not anymore? No.
Nope, I
Yeah.
fully leaned into my business. And then as a result of everything that we went through with Meadow and like really genuinely being on the cusp of medicine right now, I do
Mhm.
so much advocacy work because I feel like I'm in this incredibly leveraged position to be a medical provider and have the knowledge to back it up and the understanding, but also like the flexibility that being an entrepreneur and selling my business has given me to like be a really fierce advocate and have the space for that. So I do a
Yeah.
lot of congenital heart disease advocacy work, and that like really lights me up and gets me excited these days.
I love that. And I know that we talked about us when we initially met was earlier detection, because you
hmm
weren't well, Meadow wasn't diagnosed until the 36-week ultrasound, correct? And nowadays that should not be happening. You
Well,
know,
what
y
I tell people is if you look at the data, if you have all four chambers of the heart, so if you have all four chambers, doesn't matter if you have holes or missing pieces or all the things Meadow did, only half of the defects get caught on ultrasound.
wow.
It's crazy. Just
It's
half.
very crazy with where we are in medicine and the advancements that we
hmm
have. It's that's kind of crazy
It's
that that's
wild.
still the statistic. Yeah. It's unfortunate. Yeah, so I love that you've turned your passion, and from the first episode, your passion
Mm.
was, education, and
Yes,
like
I'm going to
this.
change the world of nursing education,
Yeah.
which I
Yeah,
did, and that was
and you
fun.
did. Yeah, and your full circle moment that I will never forget that story, and so, yeah,
Yeah,
anyone that didn't
brings me a
listen
lot
to
of joy.
episode 1, go back and listen because it was pretty amazing. But, being able to do that, but now just, taking, and this is still part of education, is
For sure.
taking and research and trying to figure out how to, you know, how can we help this? How can we maybe one day cure it? Is that even a
Yeah,
possibility? That
I
would
think it
be,
is, but
yeah, yeah. And, I think that I'm excited to follow your journey and to follow, you know,
oh, I'm loud and proud out there.
yeah,
I'm a
yes. And
mental health, CHD.
yeah, no, I love it. And all of it goes hand in hand. And that's why I think that it
Mhm.
was really important to have these two separate episodes kind of come together into, what 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 it's like to be a nurse. I mean, at the end of the day, this is your nursing story, and
Yeah,
you're taking your personal experience with your education background as a nurse practitioner, and you're implementing this to better the future for more parents and more babies. And
yeah.
that's incredible. So,
It's really,
you
really
know,
cool.
we talked about this, but I thought, I wanted to kind of end on a positive note. But when we first met, my producer was like, "What is your life mission?" And I love that, because I always ask what the passion is, and I think that would be a really wonderful way to kind of wrap this up.
I think my life mission at this, I've really been saying to people the last few days, and like it's really resonating for me, is awareness changes lives, but action saves them. And so the first hurdle that I'm up against in this congenital heart disease advocacy journey is just people understanding this is like a real, genuine problem, and that 1 in 100 babies will be born with a heart defect. And of those 1 in 100, 1 in 4 of those will need life saving surgery by the time they're a year old.
Wow.
All of that is just like mind blowing for me and my medical
Yeah.
brain. But I think like my big, fun, kind of audacious goal is finding a cure for congenital heart disease. I don't think it's out of the realm. We have made so much progress so fast in this realm specifically. I think I might have told you too, like if Meadow, because she has some more complexities to her TOF, but if she'd been born just 50 years ago, like there would have been no surgeries to save her.
No.
There wouldn't have been anything for her. And so to think even in just like that short span of time, how much things have changed, how we're on the cusp of change again, and what that could possibly look like in the future with more research and more innovation and honestly more education too. Like, I think in the next 100 years, there could absolutely be a cure for congenital heart disease. And I would love to spend a good portion of my life trying to support that in the like avenue and the platform that I have.
Yeah. And I love that so much. And you make a very valid point with 50 years ago. If Meadow would have been born, there wouldn't have been the opportunity for these surgeries. And, 50 years is like our lifetime. Like I
It's
think
nothing.
about it's really nothing. And neonatology is so new. I mean, it's only been
Mhm.
around 50 some years. So, I love your life mission, and I am excited and I'm happy that you are so invested in that and that you have now thrown yourself into working at that, and bringing awareness is the first part. And I'm very grateful that you came on here. You have been extremely vulnerable in all aspects of all of this. And that's all I can ask for with this podcast.
Mhm.
And, people feeling more comfortable about voicing their experiences and, what that's what nursing is at the foundation. And we need to get back to that. So I just appreciate your honesty, your vulnerability, and everything. And I hope that we can do this again one day.
Yeah, yeah.
And
I'm
you can
sure there
come
will
on here.
be.
Go ahead.
What were you going to say?
I was going to say, you can come on and share the advancements that you've helped to facilitate on the federal level with congenital heart disease.
Yeah, that'd be really cool. I'm sure there's gonna be a next iteration of this story. Like
Yeah.
there absolutely has to be.
Yes. Was there anything else you wanted to share, or any insight you wanna leave as your lasting
I
words?
just love to give people a way to connect with me because
Yeah.
like I genuinely love human to human connection, especially when it comes to heart moms or people that are struggling with their own mental health. So I have a website. It's literally just sarahmichelleboes.com. That's B as in boy, OES, by the way. And I don't know exactly when this is airing, but I'm in the midst of doing a 9-week fundraising campaign right now through the American Heart Association. It's called the Women of Impact Campaign. And my whole goal with that campaign is just to shine this really bright light on congenital heart disease because it's obviously a portion of the American Heart Association's mission, but it's just one bucket. And so if I could use winning this campaign to make it really loud and bright for a moment, I would love to do that. And it gives me an even more like bigger excuse to talk about congenital heart disease all the time for 9 weeks. So
Yes.
I'm like taking advantage of that too.
Yeah. But you already have a big excuse to talk about it all the time. And your
Yeah, yeah.
passion and your dedication towards it is felt and heard. So I appreciate you, and I'm so grateful to have met you. And thank you again for coming on and sharing your story. Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.